La primera conferencia, Higiene de manos, un determinante clave de la resistencia antimicrobiana en los hospitales europeos. Es una conferencia que se impartirá en inglés, pero el que quiera traducción simultánea la va a tener, y los que estén atentos por streaming va a haber traducción simultánea. Luego en la ronda de preguntas la conferencia será de unos 20 minutos, también en las preguntas se las van a traducir, no habrá ningún problema con el idioma. Carl Suetens es experto en infecciones asociadas a la asistencia sanitaria del Centro Europeo para la Prevención y el Control de las Enfermedades. Adelante, muchas gracias.
Muchas gracias. Good morning. My name is Carl Suetens, so I will speak in English because my Spanish is really not good enough to give an entire presentation in Castellano, but I hope I will be able to give you some perspective on the prevention of antimicrobial resistance with the main focus on hand hygiene, but also looking at other aspects. So what is the importance of hand hygiene? Hand hygiene is the main action, actually seen as a main action to prevent healthcare-associated infections. Every year we have approximately 4 million of patients that acquire an infection while receiving care in European acute care hospitals. An estimated 90,000 patients die every year from these infections, and hence are the main pathways for the transmission of germs during healthcare. Therefore, hand hygiene is the most important measure to avoid the transmission of harmful germs and pathogens and prevent healthcare-associated infections. Since more than 10 years now, the WHO has, the World Health Organization, has launched the Clean Your Hands campaign, the WHO Save Lives campaign, which is really very developed, and you can find a lot of tools and information on the website of the World Health Organization, with a very important document here on the right, which is the guidelines for hand hygiene. And I will take some extracts from that just to introduce the topic of the hand hygiene. So first, who should be concerned by hand hygiene? That is basically any healthcare worker, caregiver, or person involved in patient care. They all need to be concerned about hand hygiene. That even includes actually family members who are taking care of patients in the hospital, for example. And then how do we perform, or what do we use for optimal hand hygiene? Well, since more than 10 years, since the campaign started, clearly alcohol-based hand rub is now the preferred solution for routine hand antisepsis because it's more effective, it's faster, and it's better tolerated. Hand washing with water and soap still has its place as well, but it is in routine, it is actually replaced by alcohol hand rub. When do we still need to wash our hands? That is when hands are visibly dirty or soiled with body fluids. And also, for example, after exposure to spore-forming pathogens, and then we think mainly on Clostridioides difficile because that is a pathogen which is causing also a lot of problems in the hospital environment, and the spores are resistant to alcohol-based hand rub. That is why we also we cannot completely abandon, certainly not hand washing. When do we need to perform hand hygiene? There are the five moments for hand hygiene of the WHO. The first one is before touching the patient. The second one, before any clean or aseptic procedure, such as insertion of a catheter. The third one is after removing a urine sac, for example, so after potential exposure to body fluids. The fourth one is after touching the patient. And the fifth one is after touching patient surroundings. The one that is very often actually forgotten is before touching the patient. Healthcare workers will often decontaminate their hands more when they leave, which is more a little bit to protect themselves. than to protect the patient. So that there is a relative more work to do here at the level of the before actually the contact with the patient starts. How to hand drop, you will find a lot of videos, very good guidelines, all of that on the WHO website as well. We're not going to go into the details for that. Which are the factors influencing adherence to hand hygiene practices? So first of all, what the WHO hand hygiene guidelines say is first that the doctors are usually less adherent to hand hygiene than nurses. That is a classic, which is seen all over in different countries. Then second, the intensity of patient care, high workload, understaffing always comes back as well as a risk factor for low compliance with hand hygiene. For example, in the ICU, you will see that in intensive care units where there is a lot of work, you will see actually lower compliance with hand hygiene very often. Then, of course, lack of knowledge, lack of awareness that there are these pathogens which you cannot see and which are transmitted by poor disinfection of the hands. Then, of course, also the accessibility of the hand hygiene products is very important. That is why there is a recommendation to place the hand hygiene the alcohol hand drop dispensers at the point of care. So that is next to the bed or basically within arm's reach from the patient's bedside. Of course, also insufficient time for hand hygiene is a reason that health workers very often will give why they are not able to comply with hand hygiene all the time. And then also some reasons, skin irritation and the fact, and that's a misunderstanding, the fact that they are wearing gloves. But gloves do not replace hand hygiene. You still need to do hand hygiene with alcohol hand drop, despite the fact that people are using gloves, which are often not sterile either. So there is a lot on that in the guidelines as well. Then in another study, more recent one, a European study, what was seen there is that factors influencing hand hygiene were high income for a country, even though alcohol hand drop is not so expensive, but it seems to be a factor which is quite important. And also the existence of a national program for training of infection prevention and control nurses was also very strongly associated with higher consumption of alcohol hand drop in this prohibited study. How can we improve the hand hygiene and the prevention? According to the WHO, you need to implement clearly a multimodal hand hygiene improvement strategy. And the first one for that is to change the system to make things more accessible, and is one of a very important factor which we will also see later. Second is to provide training and education to the healthcare workers. Third is to evaluate the hand hygiene practices and give feedback to the healthcare workers of their performance in terms of hand hygiene compliance. Fourth is to put reminders in the workplace everywhere in the hospital to make it very visible that the hospital is working on hand hygiene. And fifth is to create really an institutional patient safety climate, which also involves the director of the hospital together with the infection prevention and control teams. That's this climate of patient safety in a hospital is something that is also shown to be really important. So when we look, we're going to look now a little bit at the results relating to hand hygiene from the European Point Prevalence Survey of Healthcare-Associated Infections and Antimicrobial Use, held in 2016-2017. That was the second point prevalence survey that we conducted at European level. in 29 countries, 2,257 hospitals at least participated. And we analyzed a sample of 1,270 hospitals with more than 300,000 patients. In the ECDC PPS, we collected a large number of indicators of infection prevention and control programs, and there are in those also a number of indicators which are related to hand hygiene, such as the alcohol hand rub consumption, which is used as a proxy of the actual compliance with hand hygiene, and is also shown to be correlated with that. And then we looked on the other side as an outcome variable. We looked at the composite index of antimicrobial resistance in healthcare-associated infections. So what is that? That you put basically together all important markers of antimicrobial resistance, such as MRSA, glycopeptide resistance in Enterococci, third-generation cephalosporin resistance in Enterobacteriaceae, and carbapenem resistance in Pseudomonas aeruginosa and Acinetobacter baumannii. And so when you put those together, you have an index that you can look at in a prevalence context, because when you take a snapshot of prevalence, then you don't have that many events on one day. That's why we pool these together in one index. And then we validated this index against the data of the EARSnet surveillance of ECDC, which is well known. And you can see here on the right that there is a very strong correlation between the antimicrobial resistance index from the PPS and the same index calculated from the EARSnet data. And so Spain here is in the middle for Europe with a resistance index of between 20 and 35. Prevalence of antimicrobial use and change of antimicrobials was the first factor that was associated with this resistance. So Spain is in the upper quintile actually for prevalence of antimicrobial use in the hospitals. And so that will be an important factor still in Spain to work on in terms of prevention of antimicrobial resistance. We also looked in the point prevalence survey at the percentage of antimicrobials which was changed actually at the time that we measured it. So changed for either escalation or de-escalation, or a switch from intravenous to oral, or for adverse effects. And there Spain is performing, let's say, in the mid-range also. So this is actually an indicator of antimicrobial stewardship at the hospital level, how clinicians and actually also external persons going to the wards and looking at each treatment and seeing whether it can be changed, whether there is microbiology available that allows you to perhaps narrow down the spectrum of your treatment, etc. When we look at those two variables and with the correlation with the resistance, you see that there is quite a strong correlation of the prevalence of antimicrobial use, so the percentage of patients receiving one antimicrobial, with Spain being here. So quite, let's say, quite a low resistance for the high percentage of antimicrobial resistance. And then the percentage of antimicrobials changed during treatment. There Spain is nearer to the middle, also strongly correlated with the resistance in healthcare-associated infections. Second factor, and that's the main topic of this presentation, is the alcohol hand rub consumption, where Spain is in the also somewhere in the middle between consuming between 20 and 30 liters of alcohol hand rub per 1,000 patient days. A bit improved in the second PPS compared to the first PPS 5 years ago in 2011, 2012. And then also where Spain is particularly scoring well is in the presence of alcohol hand rub dispensers at the point of care, so near the bedside or close to the bedside. What we see here is that actually the percentage of beds with alcohol hand trap dispensers is related to a higher consumption of alcohol hand trap as expected. So it is working to put the dispensers there close by the bed. These two factors are also correlated with the composite index of AMR, with here on the left side the alcohol hand trap consumption, and on the right side the percentage of beds with alcohol hand trap dispenser at the point of care. So you can see Spain is scoring well here, a bit less on the alcohol hand trap consumption actually. So not very clear why that is. For the correlation here, it is strong, but there are two outliers. These are Greece and Cyprus, where the consumption is actually paradoxically high for the level of resistance that we see. And it was the same also in the first PPS. So we are still looking into reasons why that could be. And one of the reasons is probably that they use a lot alcohol hand trap to disinfect the environment rather than to disinfect the hands. So for cleaning, basically. And then the next factor strongly correlated with resistance is the isolation capacity in the hospitals, measured by a proxy variable, the percentage of beds in single rooms. And there Spain is also scoring quite well, with 20 to 30% of beds that are located in private rooms, basically. And then finally, the next one, in terms of factors of infection prevention and control related with resistance, is the number of full-time equivalents infection prevention and control nurses, which are in the hospital. So the more staffing of so hygienist, nurse hygienist, I don't know exactly if you or how you call them in Spain, but infection prevention and control nurses are a very important staff in order to prevent infections and antimicrobial resistance. And there Spain is also scoring in the middle with less than 1 per 250 beds full-time equivalent. Finally, what we also see is a correlation with blood culture rate, which has to do with the fact that some countries who don't test a lot, they will find higher resistance because they only test when the first-line treatment is not working. And then they take a culture, and so they have a higher chance, of course, to capture microorganisms which are resistant. So now, if you look at all these factors, of course, some of them are correlated together, and therefore we looked at that in a multiple regression, so to look at all the variables together and look at the independent effect of each of these variables at the hospital level. And we see that the infection prevention and control nurses remain significant. The alcohol hand trap consumption remains significant. Oh, sorry. The beds in the single room, so the isolation capacity is independently associated also. The prevalence of antimicrobial use and the antimicrobial stewardship, the change of so all 5 factors need to be addressed if you want to be effective in preventing antimicrobial resistance. This is adjusted for case mix severity and also adjusted for the blood culture rate, which was actually not significant in the multiple regression. So we just looked also shortly to what are these factors related, hand hygiene, to what is it related. And we see it is related to the workload as measured by the staffing of nursing, registered nurses and nursing assistants. So low staffing has overall lower consumption of alcohol than hospitals with higher staffing per 100 beds. And then within that, you also see that the occupancy is quite an important factor. So if your hospitals are completely full, then there will be too much work for the nurses and they will not have time to disinfect their hands. But Spain is doing quite well for both indicators, actually, both for the nursing staffing levels As for the bed occupancy, which is quite low, so not red, that is data based on the denominator data of the previous year, so the number of patient days and the number of admissions. So another factor which I wanted to show here is also a direct link between the consumption of alcohol and the infection prevention and control nurses. And that is probably the effect of training. You need the nurses to train your healthcare workers regularly, to put on the posters in the hospital and to create this culture of hand hygiene in the hospital. So in conclusion, the hand hygiene is an important independent determinant of antimicrobial resistance in healthcare-associated infections in European hospitals, in addition to antimicrobial use prevalence, the antimicrobial stewardship, so the quality of your antimicrobial use, infection prevention and control nurse staffing levels, and the isolation capacity to isolate patients when they are carrying alert microorganisms that need to be taken special care of. Alcohol-based hand trap consumption in the point prevalence survey was associated with the workload, with the alcohol hand trap dispensers at the point of care. I showed you that earlier. And then, as the previous slide, with the levels of infection prevention and control nurses per se. So if we look again at these WHO multimodal improvement strategies, we see that Spain is actually doing quite well for the accessibility of the product. There is time, the training and education needs to go through the infection prevention and control nurses, so there is certainly room to improve the levels of infection prevention and control staff there. In terms of evaluation and feedback, we didn't measure that in the PPS. Neither did we measure the reminders in the workplace or the creation of a safety climate. So the specific recommendations from the ECDC PPS are actually for whole Europe clearly to increase the nursing staff levels basically to 1.5 to 2 per 250 beds. That is basically the double of the previous recommendation that we had. Then installing these alcohol hand trap dispensers, ensuring adequate nursing staffing levels and in accordance with the workload and the bed occupancy, increasing the percentage of single rooms, increasing post-prescription review of antimicrobial treatment, ensuring dedicated time for antimicrobial stewardship consultancy. What we also need to work on is harmonize the diagnostic testing across European countries. And then finally, also we have some recommendations for the PPS methods, but we won't go into that. So I just wanted to not to forget the antimicrobial use. Areas that can be worked on are, for example, the use of broad-spectrum antibiotics in acute care hospitals. That's published in last year at the European Antibiotic Awareness Day. And also the proportion of antibiotics used for medical prophylaxis, which is an indication of antimicrobial use, which often lacks evidence actually, so there can also be some actions on that point. So thank you very much for your attention. All the teams here that coordinated this national point prevalence surveys, and then of course all the hospitals that participated, and in particular the hospitals of the EPINE project here for Spain, which are more than 100 or sometimes more, several hundreds of hospitals that participate. Thank you.
Tenemos tiempo, 5 minutos, para alguna pregunta. ¿Tenéis alguna pregunta que hacerle a Carl? Levantáis la mano. ¿Alguna pregunta? Bueno, pues yo sí que tengo una pregunta.
Ninguna pregunta. Okay.
Mira, mientras estabas haciendo la charla hice una búsqueda rápida en internet sobre usar desinfectantes para manos. la gente común. O sea, quiero decir, pues cuando vas a hacer un viaje y demás, hay mucha gente que lleva estos desinfectantes. Y claro, haciendo una búsqueda por internet sobre si funcionan, pues ya la tercera entrada que me sale a mí en Google ya te dice por qué no deberías usarlo. O sea, ese es el nivel. Y dice cosas del tipo, bueno, es que lleva algunas sustancias como el triclosan, los parabenos, bueno, dice muchas tonterías, y algunas de ellas es que, por ejemplo, que puede afectar al microbioma de la piel. Es decir, que usar ese tipo de sustancias en las manos constantemente puede afectar al microbioma, y de ahí ya llega a la conclusión de que generaría una resistencia bacteriana. Pero ¿afecta realmente, por ejemplo, al microbioma, a la salud del microbioma de la piel, utilizar este tipo de desinfectantes?
I'll answer in English. Okay, so you're asking how it affects the microbiome. Actually, yes. So I'm not personally a microbiologist, so I'm probably not the best place for that. But what we see is that for sure the bigger the use or the larger the use of alcohol, the less resistance you will get, and the less. So if okay, it will affect also the skin contaminants and all those, the normal flora on your skin. But on the other hand, they also contain resistant pathogens like Staph aureus or which will also be affected by the process. But I'm not aware actually on the more thorough long-term effects on that, I have to say. Yeah.
Muchas gracias. ¿Alguna pregunta más entre el público? Sí, ahí hay una pregunta.
Yes, very nice talk. Thank you. There have been this year and this last year, there have been several outbreaks in several hospitals in Europe and also in Australia and in the US with Enterococci, fecalis and faecium that are tolerant to alcohol. So bacteria are very smart, and finally they get used to alcohol, and there have been several outbreaks. Are you thinking of starting some surveillance of these kind of specific clones in Europe so that we could in advance maybe detect them? Thank you.
Yes, well, we have an early warning system at ECDC, which is we have two early warning, one official one and then one more low level, which allows countries to report events like that, which are reportable events clearly. If that becomes a big problem, then we are really we'll need to think of other disinfectants. But a specific surveillance of it is not planned yet, but there is, of course, a system that captures these, that should capture those events. Of course, the countries need to capture them as well. So the hospitals should report those events if they know about it to their national ministries, who then or surveillance institutes, who then report it at the EU level. But yes, point well taken, and we'll look closer into that. Maybe it's time to take additional action already at this stage. Yes.
¿Alguna pregunta más? Sí, ahí hay una pregunta.
Ahí.
Thank you, Carl, and this interesting presentation. Let me ask you about, do you think that this hand washing program should be extended to visitors of the hospital, not only healthcare workers and people
Basically,
or relatives
yes.
taking care, but visitors, family, relatives, and friends visiting the hospital, visiting some patients in the hospital at the entry and in the exit of the hospitals?
Actually, when they are with the patient. When they are, and in particular when you have visitors that also say hello to the patient which is on the next bed in the same room, that should not happen. When there should be disinfection as well for them if they have contact with the patient that they are visiting or their family member. Even to protect the family member, they should disinfect before they touch it. That is why it is important that there is alcohol hand rub available at the bedside, so that the family can also actually use it. Yes, they are also concerned. It is, of course, less critical than those who are giving the care, so the nurses and the nursing assistants, the doctors, but in terms of transmission, the risk also exists for them, right? So.
Bueno, pues muchísimas gracias, porque no tenemos tiempo para preguntas. Thank you so much, Carl.